SAC Health has a very rich history. It was started actually back in the 1960s by medical students from Loma Linda that wanted to create a free clinic. And so they started providing free services 1 day a week in the evenings in the city of San Bernardino, but they didn't have a permanent location to do it. So they would just use whatever was available. Sometimes that was the basement of a building. And then finally, it was in the early 90s that the Norton Air Force Base was closing in San Bernardino, and they had a clinic on the base. And so they worked with the federal government to get that site, and that was the first SAC clinic in 1995. Fast forward, we have 10 locations and a mobile unit. We are the largest specialty-based federally qualified health center and the largest teaching FQHC in the nation. And currently we have about 50,000 Medi-Cal patients that we serve. The majority of those are IEHP members. We would not be where we're at without having that strong partnership with Inland Empire Health Plan to be able to do what we're doing in the communities and be able to, serve the population that we're serving. As a health plan, I don't think there's anything like IHP that exists anywhere else in the nation. So when we learned that CalAIM was going to go into effect January 1, 2022, and there was going to be expanded service areas that IHP would move into, we said, okay, we're going to go to Blythe and we're going to go to Barstow. Now, we did not know how we were going to do it. We did not have at the time the physicians. We did not have facilities. We did not have the cash to do it. And it was about 8 months before we knew we had to go live and provide services, and none of that was in place. But we sat around the table and we took the team and said, we're going to do this. Within a few months, we had 2 physicians for Blythe. And then again, within a few weeks, we had a facility. And really for the first time in the history of that community, board-certified physicians were seeing Medi-Cal patients. In Barstow, it was a little bit different because we were having a really hard time recruiting physicians. And we found a facility, we started hiring staff, but we didn't have the physicians. And then the first week of December, now this is only less than a month before go live, I still don't have a physician. And I get a phone call from the CEO of another health center. And he says, we have a clinic in Barstow and we have 4 physicians there and we have to close our doors and we're not sure where those physicians can be hired. And I said, I know where they can be hired. We could just see God opening the doors and providing for us as we took a leap of faith to move into these communities where the need was huge. To Inland Empire Health Plan, we are overwhelmed with gratitude and humility to be able to be honored with this award, but also the immense gratitude for the partnership that has been such a blessing to the patients, to the community that's so well loved. You can't do this kind of work and truly impact the community and those that need the care without really strong partnerships, because it takes a whole community to do that.